Okay, so now we look at the rate of growth, the difference between the rate of growth of benign and malignant neoplasm. Now for benign neoplasm, it tends to go slowly. So you takkan tengok hari ni you nampak lam tu, minggu depan dah besar macam golf ball. It wouldn't be like that. That's not usually not benign growth. Exceptions, of course, there's always exception. For example, a leiomyoma ataupun a benign growth of your smooth muscle, it can go quite fast, but it doesn't mean that it's malignant. Okay, while in a malignant neoplasm, it's usually faster and it correlates with the level of differentiation. So that means the more differentiated it is, kalau well differentiated, it tends to go slower compared to an undifferentiated or poorly differentiated. But that just makes sense kan, kalau benda tu nak jadi lagi cantik shape dia or lagi betul bentuk dia sama dengan normal cell, of course it will take longer. So that's why it grows slower compared to one yang can just be any kind of shape or form. Then of course the growth is much faster. Sometimes the growth is so fast, there's even a central area of the growth that does not get enough blood supply. Maknanya the cell grows terlalu laju sampai dia punya supporting structure cannot cope. There's not enough blood supply to cover the central area of the growth. So then you get ischemic and sometimes what we call central necrosis. Now this is what causes pain in the patient, because any form of necrosis is very painful. So if you get really fast growth with not enough blood supply, the central area yang paling jauh daripada your collaterals or your connective tissue tu, the central area tu, that's where it will be affected the most. Dia tak dapat the oxygen, dia tak dapat the food, and then it will go into necrosis and die. Okay, and this all depends on blood supply. So the growth ni not just depends whether it's benign or malignant, it also depends area tu banyak blood supply atau tak. The more blood supply it has, the faster it can grow. And also pressure. So depending juga kawasan dia macam mana. If it's a growth in the brain, you cannot grow that big anyway sebab there's a skull around it. As compared to kalau growth inside the abdomen, it can grow very big because space dalam your abdomen is so big. You tengok your perut punya area, right, your own abdominal area, how big it is and how much space it can actually expand. Me look orang pregnant 9 bulan, right, they can actually have a 4 kilo baby inside there. So technically you can grow a mass of cell like 4 kilo size, even more than that in the abdomen because there's enough space, right? So that's the second one. So the first is how much the new growth looks like normal cell or not. Second is the growth, how fast it is. And third is what we call local invasion. This is where the new growth invades into the surrounding area. Okay, either you kena think 3D ya. It can go ke kiri, ke kanan, ke atas, ke bawah, ke depan, ke belakang. So there's 6 areas where it can actually grow. So next to metastasis, which we'll talk about later, the most reliable feature to differentiate between a benign and malignant neoplasm is whether it invades locally. So for benign neoplasm, it tends to remain local. Maknanya dia nak pergi masuk dekat space-space orang. Dia grow, tapi dia grow kat area dia je. It doesn't go invade locally. So there's no capacity to infiltrate, invade or metastasize to a distant site. Dia tidak pergi ke mana-mana. Usually the growth itself ada capsule around it, so dia capsulated. It's well demarcated. That means you boleh nampak mana the margin between the new growth dengan the normal cell. You can clearly see it. Cleavage ni is not that kind of cleavage. And this is well-defined cleavage di mana ada plane, di mana ada angle for you to actually remove the thing. Is very easy sebab you dah ada capsule, dah senang nak nampak. So bila you nak operate actually to remove this benign neoplasm or this new growth or new mass, you can actually nampak plane dia untuk remove. Now this is a bit difficult nak faham kalau you tak pernah buat surgery. But if you done surgery, you know, you akan senang nak take it out. So bila you take it out pun dia punya rupa tu cantik je, bulat je, nice and clean, as compared to a malignant one. Okay, but of course there's exception again. For example, it's a benign vascular tumor. Kalau blood vessel punya tumor, even though it's benign, it may not be well capsulated or well demarcated just because of the physical structure of a blood vessel. Okay, that's the only reason why. Now for a malignant growth or malignant neoplasm, it grows by progressively infiltrating. That means memang inherent nature of a malignant growth, it will grow by infiltrating and progressing beyond dia punya border. Dia akan masuk-masuk area orang. Dia sangat agresif, okay? Dia akan invade, dia akan destroy, and dia akan penetrate the surrounding tissue. And usually there tends to be no capsule, okay? Tiada kapsul di keliling dia. And there's no nicely defined plane for you to remove sometimes. And that's why bila surgery, it can be difficult because you tak nampak berapa banyak you have to remove. So you kena ambil certain margin. That means if you rasa this is the growth, right? This is the growth. You tak nampak the border ni not that clear. This is normal tissue, but in real life it doesn't look like that. You can't really tell ni normal tissue, ni abnormal tissue. You can see the growth there, but mana border dia? And you have to think 3D. Mana border kat atas, mana border kat bawah, mana border kiri, mana border kanan, mana border depan belakang. So what they do is that they ambil a healthy margin. So sometimes they have to remove healthy tissue that much, that much, that much, that much. So apa yang dia remove usually is bigger daripada mass tu, just to be sure that tak ada cancer cells left behind. Especially malignant yang you worry. Benign you tak worry sangat, but the malignant ones you are worried if you leave things behind. So that's why dia akan ambil margin yang quite big, okay, to make sure it's healthy. Now that is local infiltration. Dia can go ke depan, dia akan go ke belakang atau ke atas, ke bawah, depending on where they are. Now the fourth one, the difference between benign and malignant. Now this is the most significant dan paling senang, yang paling reliable untuk you decide. Okay, this is benign or this is malignant. If it has metastasis, it's 100% malignant. Benign tumor will not metastasize anywhere. Dia akan stay where it is, it will not go anywhere. But if it's found somewhere else, 100% sure it is a malignant neoplasm. So what is metastasis? It is a development of secondary implants discontinuous with the primary tumor. It's a bit like, if you remember lecture hemodynamic kita, we talk about thrombosis dengan embolism. So it's something like that. Embolism tu macam the original mass, but then some of it break off and then they travel somewhere else. Okay? But for metastasis in a tumor, dia ada banyak cara nak travel somewhere else. But for embolism, dia hanya boleh travel through blood supply. The difference dia, right? And of course, composition dia is different lah. And for embolism, once dia pergi tempat lain, dia jarang lah grow, become something bigger. Dia cuma pergi somewhere and then they block the blood vessel. But for metastasis, bila dia dah break off from the primary tumor, dia dah implanted somewhere else, for example in the brain, they can actually grow pula kat situ and become big or become more than one spots, right? So that's the major difference lah between neoplasia and a thromboembolism. Okay, but konsepnya lebih kurang sama, where you have a serpihan daripada the original mass or original injury, and then dia go somewhere else which is langsung tak berkait. Dia tak ada pun bersambung tu, dia tak physically connected, but dia dah travel somewhere else. Okay, so that is what we call metastasis, and it's always malignant. 30% unfortunately by the time diagnosed, maknanya by the time dia jumpa doktor, 30% already have clinical metastasis, or this means that dia dah ada symptom. For example, the metastasis tu goes to the bone. Dia dah complain of bone pain, right? So maknanya bila somebody datang with a breast lump for example, and then dia kata dia sakit belakang, that's not a good sign, because that means it could mean that the cancer, the breast cancer has actually metastasized to the spine, to the backbone. That's why they have pain. And even more difficult is that 20% more at diagnosis will have what we call occult metastasis. Maknanya dia tak ada simptom. Bila tanya, ada sesak nafas, ada sakit perut, ada sakit belakang, these are all metastatic symptoms, and they all say no, tak ada. But when you do scan or CT scan, you scan the whole body to look for metastasis, you find it. So this is what we call occult, di mana tak ada symptom but it has already metastasized. And once it's metastasized, you already reach a certain prognosis and a certain stage. Okay, so the treatment at that point is different compared to somebody yang tidak ada metastasis. Okay, the larger the original or primary tumor is, the more likely you have to have a metastasis. It just makes sense. The bigger the mass, more likely dia nak pecah, correct? Compared to a smaller mass, dia tak pecah sangat. And if it's anaplastic, it's even worse, because anaplastic means dia ada macam-macam shape and form, so dia abnormal. Bila abnormal lagi senang nak pecah compared to a normal tissue, so it's higher chance for you to get metastasis. Okay, So metastasis can spread via 3 pathway. Macam I cakap tadi, thromboembolism you only through blood vessel. But for metastasis you can actually spread by 3 ways. One is body cavity seeding, for example in ovarian cancer. 2 is lymphatic spread, which is commonly occurs in a carcinoma. And 3 is a hematogenous spread or through blood supply, macam the thromboembolism, for example sarcoma. So body seeding, for example ovary, this is where you have cancer in ovary but dia drop through your peritoneal cavity. It's a space banyak besar kan, so dia boleh drop down to your pelvic bone from the body cavity. Dia bukan through blood vessel ataupun via your lymph vessels, dia just drop macam tu physically ke bawah, right? And the favourite points for metastasis tends to be liver, bone and lungs, which is why you tanya ada sakit perut ke tak. In case the liver is enlarged because of the metastasis, you ask any bone pain, ada sakit-sakit tulang mana-mana for bone metastasis, and you tanya whether there is sesak nafas ke tak, which is tends to be because of lung metastasis. So the 3 common questions that you ask when somebody comes in and you already know they are metastatic or you suspect they are actually have malignant neoplasm. So this is ovary, right? The ovarian cancer looks like. So it can actually drop dia punya cancer cells down to the bone, just like that. Tak perlu lalu blood supply, right? And for breast cancer, it tends to be carcinoma. So it actually travels through the lymph nodes, lymph vessels, and then goes to the rest of the body, to the brain, to the bone, right? And for bone cancer, it tends to be due to hematogenous spread blood vessel. So you see that's normal tissue, and that is the bone cancer, so abnormal. This looks quite anaplastic. That means it doesn't look, even daripada luar ni pun you can see it doesn't look like the normal bone. Okay, so obviously this patient died because they removed the specimen, so probably that from the bone cancer. Okay, the 4 things that we talked about just now, this is a diagrammatic representation of the 4 things. So we are looking at what we call smooth muscle neoplasm or smooth muscle growth, right? Either it's a benign one, which we call leiomyoma, or if it's malignant, what we call leiomyosarcoma. So you can see this is the uterus, this is the cervix, this is the fallopian tube, this is the ovary. Okay, so the tumor is here at the smooth muscle of the uterine wall. Now if you see leiomyoma, if it's benign, it tends to be small compared to the sarcoma, it's large. The leiomyoma, you can see it's well demarcated. You can see dia punya border dia quite clearly, and usually there's a capsule. But you look at the leiomyosarcoma, it's like everywhere. There's like tentacles, tendrils everywhere, because dia punya inherent nature of a malignant growth, it tends to infiltrate to the local areas. For a leiomyoma, it tends to be slower growing compared to a leiomyosarcoma, which is rapidly growing, and then because of that, there are the hemorrhage and necrosis in the center because tak cukup blood supply, as you can see here. For leiomyoma is not invasive, you see, dia tak ada spread to, dia tak ada bridge this capsule here or bridge this capsule here atau bridge ke atas atau ke bawah atau ke depan atau belakang. But you see with the leiomyosarcoma, it breaches the back, posterior, the lateral, medial, superior and inferior. You have everywhere. They're invasive. Now the 4th difference, remember, is the metastatic. So in benign you never get it, but in malignant you can get metastasis because this is a muscle. It's a connective tissue. It tends to spread via hematogenous spread. So you see this is your uterine vein. You can see there's a tumor there. So it's moving the tumor elsewhere. And if you look, you ambil sample, you cut it, you ambil the tissue, you put into slides. So this is what it looks like. This is the normal smooth muscle. This is the abnormal smooth muscle. But you see the shape, you can still tell that is smooth muscle. It looks the same. It's still that spindle shape cell, epithelium. You can still kenal, except that here, the nucleus is small, but here you see the nucleus is slightly bigger because it's growing, okay? Even though slow. But you look at the slide where it's for the sarcoma. You see the shape, it's totally nothing like the normal cell. This is the normal cell at the edge here. You see here? It's like multiple shape, pleomorphic, anaplastic, poorly differentiated. The nucleus are big. See this one, the nucleus are big. The ratio is 1:1. And you can see mitosis inside some of the nuclei. and the mitosis are usually abnormal. It's also very darkened. The nucleus color is very darkened compared to the normal cell, and you can see also hemorrhage and necrosis in the center. So this is all the cell that is dead due to rapid growth, not enough blood supply. Okay, this is in a diagram what we talk about the 4 different comparisons between benign and malignant carcinoma. Neoplasm.